They're public, that the vaccines they are using are safe. I should just say, though, as we are waiting for that press conference by the European Medical Agency on the safety of the AstraZeneca vaccine, but there are some reports coming out already that suggest that what we might hear from the EMA is that they have indeed found some links between the AstraZeneca vaccine and rare forms of blood clot. However, on balance, we understand that the EMA is expected to say that the benefits of the AstraZeneca vaccine outweigh the risks. And what they would mean by that is something that many doctors have been saying over the past few weeks, and that is that the risk of COVID-19 to a person's health, possibly, of course, people could die from COVID-19. Those risks outweigh the risks of some very rare blood clots linked, as we've heard reported, to the AstraZeneca vaccine. So I think this is what we're expecting to hear from the EMA. As I say, those reports are unconfirmed, but we are hearing a bit of information just before that press conference begins. EMA, as I say, those reports are unconfirmed, but we are hearing a bit of information just before that press conference begins.
And it certainly puts governments in Europe in quite a tricky situation, really, because many governments in Europe have been relying on the AstraZeneca vaccine to jump-start, if you like, their vaccine rollouts, which have been fairly sluggish across Europe, has it not? What's the kind of situation when it comes to vaccination across the EU?
Well, what we're expecting after the announcements from the European Medical Agency is a meeting of European Union health ministers. Now, they will be looking at the report, at the data, at the announcement from the EMA. They'll be going over that, of course, and then reporting back to their respective governments. But you would imagine that health ministers will try to urge their governments to continue to pass on the message to their populations that the benefits will outweigh the risks in the AstraZeneca, to pass on the message to their populations that the benefits will outweigh the risks in the AstraZeneca vaccine, that people should continue to take it, especially as so many countries in the European Union are battling a third wave of this COVID-19 pandemic.
Natasha, I'm afraid I'm going to have to cut you off there. We are now getting that press conference from Amsterdam. Let's listen in.
Details of the assessment. My name is Marie-Agnes Heine, and I'm the head of EMA's Communication Department. I'm very delighted to have with me today Mrs. Emer Cook, the Executive Director of the European Medicines Agency, Dr. Sabine Strauss, the Chair of EMA's Safety Committee, the Pharmacovigilance Risk Assessment Committee, PRAC, and Dr. Peter Arlett, the Head of Analytics at EMA, who can provide additional information about the review and the scientific evidence it was based on. Before we start, I want to explain how we plan to run this press briefing. So please note that your microphone is disabled. Before we start, I want to explain how we plan to run this press briefing. So please note that your microphone is disabled by default for the duration of the press briefing. We will first hear short remarks of Mrs. Cook and Dr. Strauss, and after that we will have half an hour for questions. Once the question and answer session starts, please raise your hand in WebEx if you want to raise a question. Today's briefing is broadcast via YouTube and Europe by satellite. The footage can be used free of charge by all media, and you will find the respective links in the invite sent earlier today. Without further delay, I'm now handing over to Mrs. Emer Cook, the Executive Director of EMA. Mrs. Cook, please.
Thank you very much, Mrs. Heine. Good afternoon, ladies and gentlemen, and thank you for joining us again for this press briefing. First of all, I want to start by stating that our Safety Committee, the Pharmacovigilance and Risk Assessment Committee of the European Medicines Agency, has confirmed that the Pharmacovigilance and Risk Assessment Committee of the European Medicines Agency has confirmed that the benefits of the AstraZeneca vaccine in preventing COVID-19 overall outweigh the risks of side effects. COVID-19 is a very serious disease with high hospitalisation and death rates, and every day COVID is still causing thousands of deaths across the EU. This vaccine has proven to be highly effective. It prevents severe disease and hospitalisation, and it is saving lives. Vaccination is extremely important in helping us in the fight against COVID-19, and we need to use the vaccines we have to protect us from the devastating effects. The Prague, after a very in-depth analysis, has concluded that the reported cases of unusual blood clotting following vaccination with the AstraZeneca vaccine should be listed as possible side effects of the vaccine. Vaccination with the AstraZeneca vaccine should be listed as possible side effects of the vaccine. As we communicated last week, we convened an ad hoc expert group composed of experts from a range of medical specialities, including haematologists, neurologists, epidemiologists and virologists. Based on the current available evidence, specific risk factors such as age, gender or previous medical history of clotting disorders have not been able to be confirmed, as the rare events are seen in all ages and in men and women. A plausible explanation for these rare side events is an immune response to the vaccine, leading to a condition similar to one seen sometimes in patients treated with heparin. It's called heparin-induced thrombocytopenia. And Dr. Strauss will give us more details from the assessment.